Good evening and welcome to Wednesday Night Wellness Live. I'm Dr. Andrew Merrill here at Nightlight Chiropractic in downtown Orlando. And this is the video that we do every single week for our patients, friends, and followers on Facebook to kind of keep them appraised of current events, not just here in the chiropractic community, but across all of the health community. And it's weird times out there, right? It is just a weird world. It's unlike anything that I've ever seen. And because of that, I've been kind of hemming and hawing about what I was going to talk about this evening. You know, all everyone can seem to think about and talk about is this virus, but I'm woefully underqualified to talk to you about epidemiology or virology, so it can't really be that. Nevertheless, this is what's on everyone's minds, and I think that this is what everyone wants to hear about. So how am I going to talk about that tonight? So this is what I came up with. First, I'm going to talk to you about how my clinic is remaining open and what we're doing in the face of this crisis that other businesses can maybe start to implement, and maybe you can implement some of this stuff at your house if you're kind of quarantined and staying at home. Then I want to talk to you a little bit about what the news is doing and how that's involved, and then lastly, I want to go over all the good things that you might be missing, all the silver lining to some of this tragedy and panic that is going on. So first things first. The clinic is open right now, right? We've been operating as usual here, normal hours for this week so far, albeit with some scant exceptions, right? So some small differences that we've added or expounded upon, although a lot of this stuff we've been doing literally for 10 years. So we have hand sanitizer at the front check-in and at the back counter on your way out, right? We've always had that. It's just something that we always have and have believed in, is a sanitary way for patients to kind of enter the building with clean hands and then exit the building with clean hands. But moreover, I have 6 hand washing sinks in my office, right? So it used to be a neurologist's office and we just kept all the same sinks. 6 hand washing stations for only 5 back office people, only seeing 40 to 50 patients a day is way overkill. But here's my take on it. Washing your hands is better than sanitizing your hands. Right? If you haven't got that yet, like the hand sanitizer sold out before the soap did. There's a problem there, folks, because washing your hands is still way more sanitary and a much better way to disinfect your hands than hand sanitizer, right? So if you have the opportunity, wash your hands with soap and water. Don't just slap on some hand sanitizer and hope that that does the trick, because it probably is doing less of a job than the soap and the water. The other thing that we've started doing, we've implemented, is using masks while we're treating patients. Again, it's just a precautionary measure. I know that there's all kinds of sides and factions about whether we should be doing this, whether we shouldn't be doing this, who should be doing this. Considering that we're in contact with multiple patients throughout the day, we've implemented that so that we are on the safe side, or the maybe the more common sense side of that. So we've implemented using masks here in the office. And the other thing that we've done that is very new to us, we've never done this before, is we've closed the waiting room, right? So the only place in my office where patients are actually near each other is in the waiting room. So we've actually closed that. We've gone to a curbside check-in type process where when you get here, if we don't have space for you immediately, we ask that you wait in your car. We'll call you when we're ready for you, have disinfected the room, and then you can come right back and we have the room ready for you. That way there's no waiting, there's no contact with other patients that we couldn't control. Other than that, everything's the same, right? So we're washing our hands in between every single patient encounter. We're wiping down all the surfaces multiple times throughout the day, definitely the surfaces that patients have been on after every single patient encounter. So a lot of it is just stuff that we've been doing throughout. This is stuff that you obviously should be implementing in your home, right? So if you're not wiping down the surfaces of your home multiple times a day, not just because of this coronavirus, just because stuff gets on those surfaces, you're home anyways. If you implement it, it's only for the best. So, and keep washing those hands, right? We're doing a great job with that, I think, across the country. So keep up the good work there. So I want to move on. So that's what we're doing here in the office. We'd love to see if you have neck pain, back pain, or headaches. We're here, we're open. And I've gotten a couple questions from patients and friends alike. Why are we still open? Right? And the reason that we're still open, and I've heard this from a lot of our medical professionals who are patients of ours, is because if we can keep musculoskeletal conditions out of the hospital and out of primary care practices where you might encounter sick people, we're doing a better job. We're going to help to manage that population better without infecting more people, right? So we're here, and all of my nurses and some of my doctors who have come in to see me today, some of my practice managers who have come in as patients, have told me, thank God that you're here, because when musculoskeletal conditions try to come into our office, we tell them not right now. Now is a good time to get sick in one of our offices. Stay out, find somewhere else. So if you have neck pain, back pain, headaches, that's why we're here, and that's why we're staying open through this epidemic, pandemic, crisis, whatever you want to call it. So let's move on to the news just a little bit here. It's interesting to me that in a rather short time, in my rather short lifetime, I've gone from implicitly trusting the news to not trusting almost everything on the news, right? So if you remember back in the 80s, if you're almost my age, you remember back in the 80s, people like Walter Cronkite and Tom Brokaw and Dan Rather, the people that you saw on the news, you just like automatically trusted them. It was very weird. You could almost like be writing a paper for school and like quote Walter Cronkite from the news the night before. And nowadays you cannot do anything like that, right? The news has a slant. I don't watch the news. I try to avoid the news a lot because the spin on it, you can almost smell the spin before the story even starts. And I don't like that. The news has become untrustworthy on all sides, all factions. I know that you have your news source that you like, and I have some that I consider more reputable, but I'd argue that they all have a slant across the board and none can be trusted implicitly like you could in the 1980s. Now, it's worse in social media right now, and I coined a phrase earlier today. This cracked me up, so bear with me, but there's social distancing, right, that we're practicing now, stay 6 feet away from other people. And I actually coined this term today, social media distancing. Right, so on social media, you're on social media and you see one of your friends pops up something that is like gargle with vinegar because the virus stays in your throat before it goes to your lungs or something, and then you immediately click share, and then that shares, and then all of a sudden, literally millions of people have shared this article that turns out is not true, right? Or at least there's absolutely no proof to this. There's no research to this. I mean, theoretically, I guess it could be true, although nobody could prove that it is true or not true. So what's just happened is everyone has just shared this misinformation, right? And so this social media distancing, I just coined that, trademark Dr. Merrill, is all about keeping this information 6 feet away from you, right? Understand that this might be true, this might not be true. It depends on the sources that you're getting. Certainly when you're hearing some of these government officials talk, I would call that credible. But a lot of this other stuff that you're seeing on social media, keep it 6 feet away from you because it might be infected with misinformation, right? If you do your homework and you can say, hey, listen, this has legitimate sources behind it, I believe this to be true, I'm willing to share this, that's fine. But if you don't do that, if you're not willing to put in the footwork to do that, I'd argue that you are part of the problem and creating some extra panic by sharing some of this stuff. So social media distancing, keep it away from you just a little bit until that you're certain about the sources and the references on it, and then maybe think about sharing it. So in all seriousness, there's a lot of misinformation out there. We don't know a lot of the answers. We're all, just doing the best that we can out here in the medical community. The CDC is doing the best. The World Health Organization is doing the best. All these different government agencies are doing the best that they can with the limited information that we have. Understand that, and understand that as things come out, it's not the best information. It's the best information we have. It's not all the information. So that all takes time. Be patient with them, but don't spread misinformation. So I want to talk about the good stuff that's happening, right? So you see all this bad stuff that's happening, and the problem there is that all this good stuff that's happening is getting buried in the media. And that drives me insane because there is so much good happening. There are so many beautiful things that are happening around this crisis and this pandemic. And I think it's important that you know about some of this stuff. So I'm going to just shoot down this list real quick so that you hear some of this great stuff that's going on. So China has closed down its last coronavirus hospital that it popped up because there's not enough cases. They've actually reduced the cases from about 15,000 to about 15 per day, right? 15,000 to 15 total new cases. Not enough for a hospital. They shut down all their temporary hospitals. No, not enough cases. That's good, right? They're on like the back end of that already. Granted, they're not back up and completely running, but they've gotten to close all those hospitals that they had to erect for that. So doctors in India have been successful in treating coronavirus using a combination of HIV and malaria drugs, which is just fantastic, right? So I know that we're working on the vaccine side of it, and I know that we're working on the treatment side of it. But for these doctors in India to have found some solution is just fantastic news. It's a great place to start for those worst cases that we're going to be seeing here in the U.S. soon, unfortunately. Researchers at Erasmus Medical Center claim to have found an antibody against the coronavirus, which is interesting because that paper hasn't yet been published, but it's on the cusp of doing some good stuff, and that research will definitely be used in a smattering of other things as it comes to light if that paper gets published, when that paper gets published, because I'm pretty certain that paper is going to get published. It's pretty groundbreaking. There was a 103-year-old Chinese grandmother made a full recovery from the COVID-19 after being treated for 6 days in Wuhan, China. So there's a lot of other misinformation out there that if you're over 80, this is just a death sentence if you get it, and that's not always the case. Certainly you want to keep senior citizens and people who are susceptible to this away from this, but there is still hope if you get this and you are an at-risk individual. Cleveland Clinic just developed a COVID-19 test that gives results in hours, not days, and that's really important. Here in Central Florida, we just opened up a bunch of drive-through testing centers. The problem is it takes a couple of days to get the results back. There's all kinds of risk, and that's brought with all kinds of other problems. So the fact that we can do it in hours instead of days is fantastic. There was some other news that Italy was hit very hard, and it was hit very hard. There's some news coming out about that today, about all the deaths and what a tough time they had of it. It's positive news, I guess, or maybe a positive spin, that the experts were saying that the death toll was only high because they were the oldest, they're the country full of the oldest population. So they have a lot of senior citizens and, unfortunately, a lot of comorbidities, a lot of other sicknesses, and therefore that's why their death toll was a little bit higher. Let's see, there was 3 Maryland coronavirus patients that were fully recovered, able to return to everyday life already. So there's people here in the United States that have been confirmed cases of coronavirus who have already recovered fully and are back out of quarantine and back into the general population. A San Diego biotech company is developing a COVID-19 vaccine in collaboration with Duke University and National University of Singapore. All that's fantastic because we have a public/private sector collaboration going on here in a lot of different places that we've never had before. And that means so much. You have no idea. The public sector does a lot of the funding, and the private sector does a lot of the work. And the two come together, and that's not always true. That's an overgeneralization if you're watching this. But those two come together beautifully sometimes to get the best results the fastest. And that's happening across the world right now in great ways. Let's see, Tulsa County's first positive COVID-19 case recovered completely. They had 2 negative tests already, indicator of recovery. Again, just like that, those Maryland cases, completely cured, healed, back out in the general population. And 2 more things. So plasma from newly recovered patients has been shown that it can treat others infected with this COVID-19. So people who have had this, some of their blood plasma can help others to recover from this. And so just one more treatment methodology. Different and separate from the one in India. And then lastly, I was just reading about this today. Don't be fooled by empty grocery stores right now. Okay, this is important. This is really important because the news focuses on this right now. You see this, right? You have to have seen this. There's people who are fighting over toilet paper. That's all the media wants to talk about is all of this. And don't be fooled by the grocery store right this very second. Because according to Food Marketing Institute and a few other sources, I was just reading about this today, I did my legwork on this, it's a demand issue, not a supply issue, right? Understand that. We have plenty of supply. We have lots of food. We have lots of toilet paper. We make 90% of our toilet paper here in the United States. We're not going to run out. We have tons of food stores. We have all kinds of stuff coming to your grocery store right now. It's just that it can't get there fast enough because there's panic, right? And so it's a demand, not a supply problem. Your grocery store is going to be back full again just as soon as you know it, and you'll be able to get everything that you might need there. I think I had a question here from Emily Bergen on more info on the symptoms, right? No sniffles, no sore throat. I think, it is different. You're right. I've seen a lot of not misinformation, a lot of conflicting information about whether fever is an absolute a symptom. And really, I couldn't tell you. Like I said, I'm not the best source for that, and so I don't even want to really make a comment on that. I wish that there was some more concrete symptomology there as well. That way we could say, I know exactly what this is. And the stance that we have here in the office is if you have a sniffle, if you have a sore throat, if you have a cough, if you have a headache, absolutely, if you have a fever, you got to stay out, right? Like we can't have you here. That being said, I wish that the symptoms were more straightforward, unfortunately. So, lastly, it's a weird time out there. Like I started this off saying, it's a very weird time out there. And the only thing that I think is going to fix some of that weird is for us to come together with a little bit of kindness, a little bit of common sense, looking after our neighbors, making good decisions about how what we're doing will affect our community, our neighbors directly, our coworkers, our friends, our children directly, and then using our best judgment on that. And I think that's going to make America more whole and feel better, feel more normal than it has in a long time if we all just kind of adopt that in the wake of this pandemic that's going on. So keep a level head, keep an open heart. I'm here if you ever need me. You can email me at Dr. Merrill, drmerrill at nightlightchiropractic.com. I'm here for all kinds of questions. I'm here as a resource for you. I can maybe help to connect you to other resources that are part of larger networks of business friends of mine. I want to help. So if you know somebody I can help, if I can help you, don't hesitate to reach out to me. In the meantime, have a wonderful rest of your week. Remember to practice your social distancing. Remember to practice your social media distancing. Trademark Dr. Merrill. And I will see you next week for another Wednesday Night Wellness Live. Good night.